I never thought I would be talking about female genital cosmetic surgery on the internet, but it's been a lot on social media. I've gotten a lot of questions about it in person, in my DMs, so let's talk about it. Hey, what's up everybody? I'm Dr. Allie. Welcome to my YouTube channel. In case you're new here, I am an OBGYN. We're here on YouTube. We talk about everything. Periods, pregnancy, female genital cosmetic surgery. I share my life with you. We do vlog videos. We have fun on here. So if you're not already subscribed to my channel, go ahead and hit that subscribe button and join my family here on the internet. So, female genital cosmetic surgery. This is something that has become quite popular in, the last decade or so? The perception of wanting to have aesthetically looking exterior genitals, it's something that's been augmented by the internet and social media, and honestly by pornography. And this is ultimately driving women to seek surgical correction for something that they feel like needs to be changed. I also think a lot of it stems from our favorite celebrities and social media influencers talking about XYZ procedure that they had done, or something that's improving their sexuality and their sexual health and their appearance, etc., etc. So I'm constantly asked about cosmetic procedures on the vulva and the vagina. So let's jump into the video. Do I, as an OBGYN, recommend cosmetic genital surgery? I think a lot of this stems from what should a normal vulva look like? Not to mention how porn really truly messes with our minds and our perception of how we should look like and what we think is the desired appearance and body type. Now, as an OBGYN, I want to be the first one to say it, there is not one normal way for a vulva to look like. The size, shape, color, it all varies widely from person to person. For some women, the labia minora may extend past the labia majora. For some women, it may not be that way, and that's okay. Some people have uneven labia, normal. And it's going to look different depending on your stage of life. Someone who has not gone through puberty, someone who's in their reproductive years, someone who just gave birth, someone who's postmenopausal. It's all going to look different, and we expect the vulva and the vagina to change as we age. So what is genital cosmetic surgery? It's a type of surgery that's not done from a medical need, but from a personal preference. But you gotta keep in mind that it can come with some potentially serious complications. The risks associated with this surgery can be pain, bleeding, scarring, changes in sensation, dyspareunia or painful sex, and it can ultimately lead for the need for more surgeries. So one interesting thing, is female genital cosmetic surgery even legal? So under the age of 18, no, this is not legal, unless of course you're talking about someone that has some sort of birth defect that needs correction, stuff like that. In some states, these surgeries can actually be considered illegal and part of female genital mutilation, so you wanna make sure that you really do your research. Now, is female cosmetic surgery ever recommended or ever needed? Like I mentioned before, in some situations, these types of surgeries may actually be needed, whether it's from birth defects, from trauma, from childhood injuries, maybe someone suffers from painful intercourse, or maybe someone's been diagnosed with vulvodynia, or maybe someone who has a history of female genital cutting, something that's known as female circumcision, which is actually practiced in some countries nowadays, and it is extremely terrible and sad. So that person may need some sort of corrective surgery in that particular situation. Or maybe it's for someone who's undergoing a gender affirming surgery. So what exactly does genital cosmetic surgery actually entail? Well, this can be a lot of things. It can include things like labioplasty, a clitoral hood reduction surgery, hymenoplasty, labia majora augmentation, a vaginoplasty, and a G-spot amplification. Labioplasty is going to be the most common one, and this could be done to make the labia majora or labia minora even in size and appearance. A clitoral hood reduction makes the covering of the clitoris smaller. A vaginoplasty is marketed in a way to make the vagina tighter. A perineoplasty is marketed in a way as a means to strengthen the perineum. You may have also heard of the term of vaginal rejuvenation surgery. These again are marketed in the way, especially towards older women, to make their vagina appear and feel younger. As I'm sure you can tell by the way I'm talking about this is all used as a marketing scheme and is never necessary. Unless, of course, it's one of the things I mentioned before, like birth defects, stuff like that. These female cosmetic surgeries are not recommended, and when you look at the research studies that have been done, it has been proven to not be safe or effective. Like I mentioned before, there are a lot of risks associated with these surgeries that can then lead to more potential complications and pain and scarring, or the need to have then multiple surgeries done. Now, if you've been following some of these celebrities that talk about having vaginal rejuvenation or having a laser treatment on the vulva or vagina, please be very careful when you read into these things. A lot of people are getting their information from the internet or from celebrities, which again is not evidence-based medicine. In 2018, the FDA actually warned us against the use of energy-based devices, things like radiofrequency or lasers, for vaginal rejuvenation, or any sort of cosmetic vaginal procedure to treat symptoms of menopause, urinary incontinence, or sexual function. So we definitely need to have more research to prove if these procedures are even beneficial or if they're just causing harm. So maybe you're in a situation where you personally feel very unhappy about your body and the way it looks, or you're unsure if it's normal, if something needs to be changed. I hope you find yourself a great OBGYN that is able to talk to you about these issues and reassure you that your body is perfect. Or maybe they truly recommend some sort of procedure, but make sure you're going to someone with a reputable source, someone that you trust, someone you can open up to and speak to free of judgment or free of shame, because this is your body and I want to make sure that you're getting the best care possible. If you're having things like problems with intimacy, or maybe your sexual satisfaction, or maybe it's pain, there are other options than just turning to surgery. So again, make sure you're really talking to your doctor about this. It's important to also learn more about your body, about the anatomy, about what is what and where things are located. It's also important to have this conversation with your partner, especially if it's an intimacy or sexual function issue. Maybe opening up with your partner, discussing what feels good, what doesn't feel good, or issues that you have. These things are just so important. Yes, it can be a difficult conversation and it can put you in a place where you feel vulnerable. But again, I hope that you can reach this mature type of conversation with your partner. There may be other options in surgery too, things like physical therapy. I love sending patients to pelvic floor physical therapy. There is only positive things that I've heard from it. Honestly, there may be some medications that help, and maybe even counseling with your partner. It could really help. And again, these options are way more benign and way less riskier than proceeding with a surgery. So there are options out there. Don't lose hope. But if ultimately you're set on having this surgery, these are a couple questions that I want you to ask your surgeon. Ask them how many times they've performed the procedure, what risks they have, what complications they've run into. Also ask for results. How have their patients felt after the surgery? Did they have complications? Did they need to be reoperated on? It's important that you're educated and that you're going to see someone who has done a lot of these procedures. Again, I just want you to feel comfortable in your body, and I want you to find an OBGYN which you feel comfortable talking to these things about. As an OBGYN, a part of our training is to help recognize when people are having sexual dysfunction, or maybe this stems from some anxiety or depression or body dysmorphic issues. And as an OBGYN, I do feel comfortable talking about these things with my patients so that together we can come up with a plan that will work for her. So that brings me to the end of the video, but ultimately I just want to end by saying that you are perfect, your body is perfect. If you ever feel uncomfortable in your body or you have questions, please reach out to your provider so that you can talk about these questions. If you have a visit with your OBGYN and you feel like that connection isn't there, you don't feel comfortable, find someone else. And I want you to find someone which you feel comfortable having these conversations with, because it is so, so important. All right, I hope you guys learned something new or something interesting, something a little bit different today, but I hope you enjoyed the video. As always, I'm gonna leave link down below, links to all of my social media, from TikTok to Instagram to my blog, which I write in Spanish and in English. If you guys have any questions or any new topic recommendations, make sure to leave me a comment down below. All right, everybody, thank you so much for all the love and support. I will see you in my next video. Always remember to be kind and show love to everyone around you. I love you guys so much. Bye.